I'm Dr. Clark Metzger. I'm an orthopedic spine surgeon at HCA Florida West Orthopedic Specialist. A procedure that I've started doing about 8 years ago, it's relatively new to spine surgery. It's also treated by some other orthopedic surgeons, is sacroiliac joint fusion. We call it iliolumbar pain, so it's right over, if you put your hands on your hip, it's where your thumbs are. So it's become really interesting. If you'd asked me 10 years ago if I'd ever fuse a sacroiliac joint, I would have told you never, because in 20 years I'd never seen anybody get a good result from the procedure. So they came out with a minimally invasive method of doing this outpatient type procedure that has a pretty high success rate. It's in the 80% range, and in the people in that 20% who fail, about 95% of those you can get better with the second procedure. So it's something that's new that we've been underdiagnosing for years and probably undertreating for years.